Because of that, I'm here.
Gather ye rosebuds while ye may. The Latin term for that sentiment is carpe diem. Now, who knows what that means?
Carpe diem. That's seize the day.
Seize the day. Gather ye rosebuds while ye may. Because we are food for worms, lads. Because believe it or not, each and every one of us in this room is one day going to stop breathing, turn cold, and die. I'd like you to step forward over here and peruse some of the faces from the past. Did they wait until it was too late to make from their lives even one iota of what they were capable? Because you see, gentlemen, these boys are now fertilizing daffodils. But if you listen real close, you can hear them whisper their legacy to you. Go on, lean in.
Unbeknownst to history, this fragile Canadian nurse has heroically managed to cure thousands of people from cancer with a simple concoction of herbs.
Because I know that Essiac, a drug developed over the last 50 years by Miss Reen Case, can benefit the body and decrease pain while a patient undergoes conventional therapy. I know that Essiac provides a person hope for a cure when the medical profession has done all it can.
We just thank Reen Case for the work she's done for over the 50 years that she's been working with Essiac. And we say now that we know here in the States about it, we're going to continue the fight and support her because we want it.
And I feel that nature holds the answer, the only answer for cancer patients, and as such, we should have it. Our constitutional rights at the moment are being denied to us. Our constitutional rights at the moment are being denied to us. And it shouldn't even come down to a court hearing. It should be a matter of fact that we have what we want for our bodies and not have to fight for it in this manner.
In fact, as it's well known in the state of California, the state legislature actually made it a felony for a doctor to use any than the accepted methods of treatment for cancer. And when doctors are hemmed in like this and their very livelihood is threatened, they're not going to be anxious to step out of line.
We have many doctors on our side. We have many doctors in our group with cancer. And they want the Essiac just as badly as we do.
And set up the clinic where I treated for 8.5 years.
Our clinic would be full every time we were there. And there were people came in ambulances who were not able to come in for a treatment. She would have to go out and administer the medicine out in the ambulance. Then as the time went on, we watched these people be able to walk in. And finally, they were driving their own car to get Essiac.
I treated from 300 to 600 patients a week. And the only way they would allow me to do this was free of charge, and I had to have a doctor's diagnosis for every case.
After supervised clinical testing in Toronto and Chicago, Green consented, with feelings of redundancy, to further test in Boston. She worked alongside 18 doctors, one of them being Dr. Charles Brush.
I feel that if ASIAC were used in conjunction with any therapy that is now being used, that would have a great deal more merit.
In going over ASIAC, we find a much higher percentage. We find people that are sick and unable to eat, down mentally and physically, pick up under this drug.
Dr. Leonardo, he was a cancer surgeon, and he came to my clinic, and there were about 50 patients waiting, and he said, "You think you have a cure for cancer?" I said, "I'm way beyond thinking I know." And he said, "I don't believe it." I said, "That's your privilege." So he asked if he could talk to the patients, and I told him yes. And he got so interested. Then I had 5 other doctors in examining patients, and he asked if he could go in with them and examine patients, and I told him he could. So then he told me, he said, "You have it." But he was rougher than that. He was a big, bluff fella. And he said, "But the medical profession will never let you do this to us. But the medical profession will never let you do this to us." I was trying to legalize my treatment, and the patients went out and got this petition signed, 55,000 names on it. And I went before the legislature, and I lost out by 3 votes. I kept on my clinic as long as I could until they stopped the doctors from giving a diagnosis, and then I had to stop. And it's a sad thing when somebody comes and they have somebody that is ill with cancer, and the medical profession can do nothing for them, and they beg of me to treat them. It's a very, very sad thing to turn them away. And I had a nervous breakdown over that, so I really had to stop.
Let me tell you something you already know. The world ain't all sunshine and rainbows. It's a very mean and nasty place, and I don't care how tough you are, it will beat you to your knees and keep you there permanently if you let it. You, me, or nobody is going to hit as hard as life. But it ain't about how hard you hit. It's about how hard you can get hit and keep moving forward. How much you can take and keep moving forward. That's how winning is done. Now, if you know what you're worth, now go out and get what you're worth. But you got to be willing to take the hits and not pointing fingers saying you ain't where you want to be because of him or her or anybody. Cowards do that, and that ain't you. You're better than that. But until you start believing in yourself, you ain't gonna have a life. Don't forget to visit your mother.
Well, I have given my life for it. I couldn't give any more than that. God's been good to let me live this long, to see it used. And used by people. If I had listened to the medical world, I would have distributed it to animals. But I wanted it for human beings. I wanted them to have the benefit of it. So I fought for that for 40 years. That's a long time.
Hey. Don't ever let somebody tell you you can't do something. Not even me. All right? You got a dream, you got to protect it. People can't do something themselves. They want to tell you you can't do it. You want something, go get it. Period.
My name is Sergeant Rick Schiff. I'm an 11-year veteran of the San Francisco Police Department. I hold the department's highest Medal of Honor for bravery. That used to mean a lot more to me than it does now. What I'd like to talk to you about today is my now 7-year-old daughter. This is an identical twin. Her sister is now dead. Her sister, when she was 4 years old, Kristen, developed a highly malignant brain tumor that had spread throughout her spine and her brain. The doctors told us that we had really two options: take her home, let her die, or bring her in for massive dosages of chemo and radiation simultaneously. In either event, she was going to die. They were quite certain of that, and very quickly. Believing her only chance to be the standard route, we gave her the chemo and radiation. It burned her skull so bad she had second-degree burns and her hair never came back. To change her diapers, we had to wear rubber gloves because her urine was so toxic and it burnt her. At the end of 6 months, miraculously, she survived the standard treatment, although there was a high expectation she wouldn't. She still had cancer. We were told, sorry, we've done everything we can. Now she's going to die, probably within a couple of months. My wife and I, choosing not to accept that, started reading. The first book I picked up, the 3rd chapter, discussed Dr. Brzezinski. As you may guess, I have some expertise in fraud. In fact, I'm quite certain there are enough attorneys in the room that I could be vordeered as an expert in fraud. And I conducted my own investigation. I have no doubt the man is not a fraud. I have no doubt that he does what he does out of earnest belief that his medicine works. And now you're in a position to judge for yourselves whether it works or not. But it's well established by the FDA that it's non-toxic. 18 months later, we took my daughter off the anti-neoplastin. She had not died. She had no signs of tumor. She remained free for 18 months of cancer. Within a month, the cancer was widespread in her brain. We put her back on Brzezinski's. By the way, at the objections of our doctors, for some reason felt that it had failed her. We put her back on. Within 9 weeks, the tumor was completely gone. She died last July of neurological necrosis. Her brain fell apart from the radiation. The autopsy showed that she was completely cancer-free. Out of 52 cases of that disease ever, no one died cancer-free, just Chrissy. So she didn't die of a terminal illness. She died of my inability to care for her properly, and she died from bad advice. She died because there's a government institution that disseminates false information and is not looking out for the welfare of the people. You know, ladies and gentlemen, I swore an oath 11 years ago, and I think most of us in this room swore it at one time or another, to uphold the Constitution. It says life right in the beginning.